Keeping an eye on China, the nation has been seeing a surge in COVID cases with a lot of reports on social media about hospitals in Beijing and other places in China reportedly overwhelmed. I'm now joined by Jonathan Cheng, the China bureau chief of the Wall Street Journal, joining us from Beijing. Jonathan, we have been reading these reports on Twitter, on social media about long lines at funeral homes, long lines at hospitals as well, hospitals being overwhelmed. How much of this is true as far as the surge in COVID cases in China goes?
Yeah, there's no question that there are definitely more infections across China than the country has ever seen. This is a very rapidly spreading variant of the virus. A colleague and I, we went to a crematorium on Friday last week, so about 5 days ago, and there we talked to people who worked at the crematorium. We talked to 3 or 4 different people there, and we talked to a woman whose mother had died that morning. And in at least 3 cases there, we had learned that these were COVID cases that had led to the death, or at least they had tested positive prior to passing away. So, China officially had not reported any deaths at that time, and up till today, they've only reported a total of 7. So, whether or not that number is real or not, there's no question that a lot of people are getting very sick right now across China, but this is also a milder variant, so not everyone is dying.
Right. Could you also give us a sense of the spread of COVID cases, which would be some of the worst affected regions in China right now?
Well, it really started in the north. I don't know whether that's because just the variant was spreading more easily here, or because it's colder up here. I mean, we are in the depths of winter right now, and it's very cold in Beijing, so that may be the reason for it. But we're now starting to see reports that it's heading south, and you have people in Shanghai now starting to lock down. Whereas in Beijing, actually, I described last week, you had a lot of cases, and now you're starting to see life return. You're starting to see restaurants reopen. You're starting to see cafes reopen, because many people, if you're younger, if you're healthier, if you got this Omicron variant, you were knocked out for 3, 4, 5, 6, 7 days. But once you've gotten over it, you can head back out again. And so I think we're starting to see some of that. But at the same time, if you're 80 and above, if you haven't been vaccinated, then you are at danger of being pushed to a more serious state.
Right. Jonathan, are we also getting some data to explain what's happening on the ground? Could you give us a sense of the number of COVID cases per day that are coming up? How high is it if we compare it to probably the beginning of the pandemic? How many deaths have been reported in the last few days?
Yeah, so the deaths is the only thing that really people are watching now. And as I mentioned there's only 7 deaths that have been reported, 2 on Monday, and then another 5 on Tuesday. There's no question that that's probably too low. And it depends a little bit on the definition. We got a sense of that from the National Health Commission of China, which put out new guidance today that gave a sort of the criteria for defining a COVID death is quite narrow. It can't be that somebody died and they happen to have COVID. They have to have died of COVID. However, you establish that. As for the number of cases, they've stopped reporting asymptomatic cases, which is part of the practice in China for much of the past 3 years. And the number of cases keeps falling, but that isn't seen as a real accurate indicator, because there was mass compulsory testing for a long time, and now there's no longer compulsory testing. So a lot of people are testing positive at home, but these numbers are not making it into the official statistics. So it's really hard to judge today in late 2022 with 2021 or 2020.
Right, and this was a fear when the COVID lockdown was lifted, and the zero COVID strategy was actually lifted by Beijing authorities, by Chinese authorities. Are we looking at some measures now to probably address this surge in cases that has now taken place, Jonathan?
I don't know that we're going to see any change in policy. What they've done here is they've really thrown open the floodgates a little bit and said, we need to learn to live with this virus, and we need to learn to do it very quickly. I think in some very specialized cases where you have localized surges in a school or in a hospital, I think they may reimpose some restrictions. We did see in Shanghai earlier this week, schools were sent back online again, and that's one way of ensuring that the spread, at least happens at a slower rate than it might otherwise.